So if you need your implants exchanged and you probably need a lift, there's a lot of decisions you have to make. And so I want to help you make those decisions. The first decision is, do you want to have implants again? Meaning, if you're going to have your implants exchanged, if you don't, do you want to have new implants placed? Does that bother you? There are a lot of people who would love to be implant free. And if that's your goal, then you should make that your first priority. And let's talk about how we can optimize the appearance of your breasts without implants. With a breast lift and fat grafting, we may be able to achieve your goals, and then you no longer have to worry about breast implants. If you like your breast implants and you've never had any problem with them, or if you want to have significantly larger breasts that you can't have without implants, then having new implants placed is probably your best option. Another adjunct to all of this is fat grafting. So when you're having your implants exchanged, you could have your old implants taken out, new implants put in with nothing else done. If your nipples are low and the skin is loose, you probably need to have a breast lift at the time of the implant exchange. If you want to have smaller implants placed and be a little bit smaller, but you want to make up for some of that decreased implant weight and volume with fat, we could perform fat grafting as well as the implant exchange and the lift. And so all of these are options. New implants, no implants, lift, no lift, fat grafting, no fat grafting. They're all options. It all comes down to your goals. So to summarize, I know this is confusing. Whether or not you need a lift probably doesn't change whether or not you keep your implants. In other words, if your skin is loose and your nipples are low, you need a lift whether you're getting new implants or not. So that sort of decision is probably going to be made based on your current breasts and how low your nipples are and how loose the skin is. But what you do have a decision to make regarding is implants or no implants. So if you really don't want to have implants, then have them removed and we could do some fat grafting and I could give you an idea about what size breasts you'd have if you had no implants with fat grafting. If you want to have implants placed, that's fine too. So all of these are options for you. I don't want you to feel like you have to have new implants put in because you don't. If you really don't want to have large breasts and you're willing to accept smaller breasts, maybe we can reach those goals with some fat injections. So the biggest thing is keep an open mind, and what we'll do is we'll take a bunch of measurements of your breasts, and of course we'll talk about what your ultimate goals are and come up with a solution that best fits your goals and your breasts. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.